So hello everyone, I'm Aleksandra Horwood from Happy Stance Yoga Therapy, and this is short session exclusively for Brixton Housing Cooperative. Rashid wanted to give this to you. So I'm going to offer you a couple of stretches, maybe 15-minute session. So for everyone who wants just to stretch, who just maybe came back from running or did the long hours in the office or home office, or just wants like a little bit to use the some ideas how to stretch quickly. Everybody will have a chair, I suppose, at home. So let us bring the foot on top of the chair, wherever it works for you. If it's too high, you can leave it really low. Or if it's possible for you to bring it higher, let us bring it higher. Whatever is easy for you, but the standing leg has to be straight. Spine needs to be straight. Stand maybe next to the wall in case there is some issue with the balance. When we stand, we are not using the toes, we are just using roots of the toes and the heel. So right foot is on the floor, left is up in the air, and I'm bringing toes toward me. Knee is not locked and I'm not pushing knee down. I'm bringing the kneecap toward me, toward the groin area. Toes toward me, kneecap toward me. Heel away, heel pushed into the floor. And now if you want more challenge, let us go into the forward bend. But this is not like a forward bend down, it's more like going away toward the wall. It's more like a Swiss knife, only if we can do it with straight spine, then we should go lower and lower. By the moment we're going away toward the wall in front of us. So I do feel a good stretch in the top leg, the back of the knee, and as well in the standing leg. So I will now change legs. I would suggest you can do that for 10 maybe minutes, 5 to 10 minutes each leg. It does not hurt to stretch the hamstrings. They're really short in most cases. So again, both legs are straight, spine is straight. I'm lifting the breastbone always up because we really want to have open diaphragm so we can breathe freely. Heel away, toes toward me, kneecap toward me. And then I'm leaning forward, but more toward the front wall. With your arms wherever you want. This is one of the possibilities to have them back. But keep lifting the breastbone up. One possibility is to have the arms like this. And then you can help yourself and bring the leg down. If you want to stretch a little bit more, I would suggest we do it like this. You bring the leg behind, and then the leg and the torso, they're both parallel to the floor. Standing leg is perpendicular to the floor. What we could do now is we go into the opening and bringing the torso toward the ceiling. If you have wall behind you, you can use the wall. Press the heel into the wall and bring your arm up. This is a really good stretch for the arms, for legs, for torso, and for the neck. If you want, you can look up or you can look down. And then we will bend the knee, bring the foot back to the floor, and then we'll change. Maybe I will change and go in this direction. Standing leg, lifting the leg. So make sure that the standing leg is straight. So this is where the house plants are not helpful. And then bring your arm up. And if you want, you can bring the heel into the wall. And keep opening toward the ceiling. So it's really important that your head is in line with spine. You can look up or you can look down. This is quick stretch for the whole body. There's nothing that is not working in this pose. But make sure you don't do it after the meal. So let us bend the knee, and then go down. And now when we are in this pose, I would suggest we stretch again, just gently, one leg at a time. Press the heel away. And then change legs and push the heel away again. Stand. And now we will do a twist. Twist that is really good in case you have like a wall beside you or behind you, wherever it is. We will kind of hug the wall or wardrobe. You can even hug it, I don't know, fridge, whatever you have. But it's really important to have some kind of reference point. We could do it in open, but it's better to have reference point, and you can press your arms and your hands into it. So right foot is forward, left is back, and my hips do not rotate left or right. They are really square and they just look forward. So sometimes I would have here next to my right hip another brick, you know, those yoga bricks, or a book or something just to fix the hip. So it also depends on opening in your shoulder, how close you want to be to the wall. The most important thing is that the spine is straight, legs are straight. So this is really going into the shoulders, opening of the shoulders. My right hand goes away, and then I'm using my left hand to push myself away from the wall. This looks easy, but it's really an intense stretch. So let me show you on the other side. Left foot forward, right back. And then try really to go as far back as you can. But of course, the hips are still just facing the wall in front of you. You're not turning the spine toward the wall where the left hand is placed. And then we use the right hand to push away. So do it first always right side. Do it maybe twice the right side and twice the left side if you have time. Maybe 3 to 4 minutes each side. And then, of course, especially not after the meal, but in any other cases, it's really good to do that. So, of course, the twists are something that is like an internal massage for your internal organs, but also for the spine. It really helps if you feel like your lower back aches and then your mid back and like upper back. It works on opening of your body, the front of the body, and of course the back. So one more thing that we can do is something called camel pose in yoga, but it's really a simple thing to do for everyone. Opening the front of the body. You can hold the chair, back of the chair, I'll show you sideways, holding the back of the chair or the seat, and sit on the front of the chair and just hold it tight and move your breastbone up and away from you. Up and away. So this really works on the shoulder blades going down and opening the collarbones. And let me just do it from the front, opening the front of the body. Opening the front of the body. We're moving the armpits forward and chin down. We're not looking back, we are looking down so that the neck is really released. Hold the chair, the back of the chair or the seat, and bring your breastbone as far forward as you can. That means that your spine is really going into the body. So we have done some standing postures, and now this is a sitting one. This is called back bending or opening of the front of the body. Very, very important, and also good to do after the twisting exercises. And twisting and balancing and stretching in all directions, what we have done before at the beginning of this short session. So shoulders go down away from the ears. And relax the tongue and your eyeballs. Always releasing the eyeballs and the tongue. and especially the root of the tongue. And we are leaning forward as if we were like going further and further toward the front wall. And just breathe fully, and this will bring some mobility in your shoulder joints, in your shoulder blades. And then release. Then you can sit really comfortably in the chair. Put the hands behind, interlock your fingers, hold your head in your hands, and then allow the elbows to go away, not so much down as away from you. And your head is in the palms of your hands. Still looking down, not looking up, still looking down. This will open the rib cage and the armpits. Inner arms, sides of the ribs. Try to breathe in the sides of the rib cage. There is more room now because we just don't lift our arms often enough. And then interlock your fingers in the other way. And so that the other index finger is on the top of the hand, left hand, and then just again release. Release the head, all the facial muscles. And then bring your elbows in front of you and sit again on the front of the chair. And the last exercise for today is stretching again upper back. So we want to lift the right arm up, lift it really high, and then bring it behind. Try to touch the spine if you can. Go as low as you can. Elbow goes toward the head. It's really like inner rotation of the upper arm. Both sitting bones down into the chair, especially the right sitting bone down into the chair. This is really nice and intense stretch of the right side of the body. But you see my elbow doesn't go out, it really goes up toward the head and up. And head doesn't change position because the spine still needs to be straight. No matter what we do with the arms, spine needs to be straight. And then I'll release it toward you, in front toward the center of the room. And then I do the same with the left arm. I rotate to the palm of the hand looks behind. I rotate my upper arm. It's really like inner rotation. And then I bend the elbow and try to touch the spine. I go down the vertebrae, bring the left sitting bone down, not rotating out. It's still going in and up. And I'm touching the vertebrae. I'm going lower and lower, my hand. Just breathe. Feel this nice extension, all those ribs, the muscles between the ribs on the left side, they stretch, and that allows more capacity for the lungs. And then I will release, bring it in front of me, and just sit. And now sitting comfortably, I'm releasing all the facial muscles, all the upper back muscles and upper arms. I breathe deeply in and exhaling stale air. Do a couple of deeper inhalations and longer exhalations. When we exhale, the chest does not collapse. The breastbone still stays up. Shoulders release, but the breastbone stays up. Collarbones move away from each other. Wonderful. That was a short session for you. I hope you enjoyed it, and I wish you all the best in 2021.